Hey everybody, Dr. Stamper here, PetWow. I'm a veterinarian here. I wanted to answer a couple questions, and we're going to do a series. And this week we are going to start with a question of what vaccines do dogs need and how often? There are, of course, always some nuances. Generally, of course, rabies is always recommended. That comes as a 1 year or a 3 year option. Distemper and parvo, which is actually a series of 5 vaccinations. We generally call them distemper parvo. We recommend at least yearly once dogs are over 1 year of age. Of course, puppies go through a series of vaccines, generally given at 6, 9, 12, and 15 weeks, or generally in a 3 to 4 week window. We try to get a total of 4 sets of vaccines in. Then we booster those either yearly or every 3 years. There are 1 year labeled vaccines and 3 year labeled vaccines that we give the clients the option for rabies, distemper, and parvo. In this part of the country, there's another virus or bacteria, kind of a virus bacteria called leptospirosis that's considered endemic in the area, and it is recommended by the AVMA to vaccinate for that as well. That is generally for pets that are in a lot of standing water, ponds, lakes, that sort of thing. So some of the nuances there depend a little bit on lifestyle of the dog. Of course, there are also what we call lifestyle vaccines, which are like Lyme disease. Again, leptospirosis would also potentially be one of those. Those are the vaccines that generally we will talk to the client about what their lifestyle is. If they're out in the woods a lot of tick exposure, Lyme is one that we usually recommend. Or if pets are traveling to parts of the country that are either endemic or epidemic, like Northeast and the Pacific Northwest tend to have lots of Lyme disease, so we usually recommend to get those pets vaccinated there. But in general, in this area, distemper parvo, rabies, 1 year or 3 year once they're adults, and also lepto depending on lifestyle of the dog. So hope that helps, and thank you very much.